A few months ago, a 73-year-old retired engineer named Gary from Houston, Texas, walked into my clinic. Gary was suffering from a highly specific, frustrating physical limitation. Whenever he went for his morning walks around his neighborhood, his left hip would inexplicably drop down, his body would tilt slightly to the side, and he felt a persistent, deep ache in his outer buttock that made his stride look severely asymmetrical. He had tried expensive physical therapy, deep tissue massage, and custom orthopedic shoe inserts, but nothing worked. When I asked Gary to stand up and show me how he performs his daily chores at home, the structural mystery was instantly solved. Gary had a habit that millions of older Americans practice every single day without realizing the danger. Every evening, when donning the kitchen duties, Gary would spend 15 to 20 minutes loading and unloading his heavy porcelain dishes from the low drawers of his dishwasher. Because bending down continuously felt uncomfortable on his lower back, Gary developed a subconscious structural compensation. He would shift his entire body weight over to his right side, locking his right knee completely straight, and letting his left leg dangle loosely while leaning his waist hard against the kitchen counter sheet. In my surgical books, we call this destructive posture asymmetrical lateral hip hinging. Most seniors look at this habit and view it as a clever, energy-saving way to take the pressure off their aching spine while standing on hard kitchen tiles. But today, under the authority of Dr. Arthur, I am breaking down Gary's case history to deliver a profound structural warning. Leaning your body weight onto one single hip at the kitchen counter is a catastrophic mechanical trap. You are actively turning off the exact stabilizing muscles that control your walking balance. You are forcing your pelvis into a permanent, warped tilt, and within a matter of months, this simple kitchen habit will completely destroy your gait, leaving you with a short, unstable, limping stride that makes you highly vulnerable to an immediate sideways collapse. Let us look closely at the exact mechanical trauma that was happening inside Gary's pelvis every time he leaned against that dishwasher counter. When you stand on both feet evenly, your weight is distributed 50-50 across your hip joints, allowing your spine to stay vertically aligned like a structural pillar. But the exact second you shift your hips to one side and lock that knee out, you force your hip bone into extreme, unmitigated lateral compression. Deep inside the outer wall of your hip sits a small, fan-shaped muscle known as the gluteus medius. This tiny muscle is the single most important lateral stabilizer of the human gait. Its entire biological job is to contract forcefully whenever you lift one leg to take a step, keeping your pelvis level so you do not tip over sideways. Here is the exact biological crisis that occurred inside Gary's body after months of asymmetrical standing. Because his right hip was constantly jammed upward under his full body weight while loading dishes, his right gluteus medius muscle entered a state of profound chronic compression ischemia. The muscle literally starved of oxygenated blood. Over time, the nerve pathways, specifically the superior gluteal nerve, became completely desensitized and sluggish. The muscle forgot how to contract, entering a state of clinical muscle wasting and gluteal amnesia. The result when Gary tried to walk down the street was devastating. This mechanical failure is known as the Trendelenburg Gait. Because his lateral hip stabilizer was completely asleep, the moment Gary lifted his left foot to swing it forward, his right hip could not hold the pelvis level. His entire left side collapsed downward into empty space. To keep himself from falling over sideways with every step, Gary had to aggressively tilt his entire upper torso over to the opposite side, creating a jarring, limping, heavy shuffle. This asymmetrical stride places a massive grinding shear load on the knee joints, causing rapid cartilage wear, and it forces the lower lumbar spine to twist unnaturally, pinching the sciatic nerve roots and leaving your balance completely uncalibrated in the face of any uneven pavement. We are now going to implement the exact clinical movement sequence I prescribed to Gary to revive his dead gluteal nerves and level his pelvic tilt, along with the daily protocols you must execute to protect your stride. Listen closely to the physical targets and the motor learning cues. The core masterpiece, the closed-chain counter-lateral hip hike, the dishwasher trap cure. This is the #1 physical reset that overrides lateral gluteal amnesia, forcing your brain to re-engage the lateral pelvic stabilizers while you remain fully upright. The execution details. When you are standing at your kitchen counter or dishwasher, do not let your hips sink sideways. Stand tall and place both of your hands lightly on the counter edge for sensory stability. Take your left foot and place it completely flat on top of a thick book or a small 2-inch step riser, while your right foot remains hanging off the edge, floating in empty space. The action: keep your left knee perfectly straight. Now, using only the muscles inside your left hip wall, consciously pull your right hip bone straight up toward your right armpit as high as you can. Hold this peak contraction for 5 full seconds. You will feel a deep, burning muscular contraction ignite in the outer wall of your standing hip. Lower the right hip down slowly over a 3-second count into deep stretch, then pull it back up. The blueprint schedule. Execute 12 controlled hip hikes on each side every single evening before you begin your kitchen cleanup. This turns your chore time into an active neurological correction window. Supporting Protocol 1. The short lever gluteus medius pulse, wall-isolated ignition. This drill isolates the lateral stabilizers without allowing your lower back or quadriceps to steal the mechanical load. The setup. Stand with your right shoulder facing a smooth wall, about 4 inches away. Lift your right knee up to 90 degrees and press the outer side of your right knee firmly against the drywall. The execution. Keep your standing left leg perfectly straight. Take a deep breath, and as you exhale, forcefully drive the outer side of your right knee into the wall as hard as humanly possible, like you are trying to push the wall over. Hold this intense isometric drive for 10 seconds straight, breathing smoothly through your nose. Release slowly. The variables. Complete 5 maximum 10-second pulses on each side daily to rewire the superior gluteal nerve tract. Supporting Protocol 2. The parallel bipodal alignment stance, daily kitchen habit repatterning. This protocol trains your visual and tactile cortex to maintain symmetry, ensuring your body automatically protects its hip joints during long periods of standing. The setup. When washing dishes, place a small kitchen rug on the floor. Use painter's tape to draw 2 bright parallel lines exactly hip-width apart on the rug. The execution. Lock your feet perfectly straight inside those 2 tape outlines. Squeeze your core muscles lightly to 20% activation and gently squeeze your buttocks. Maintain this perfectly centered, equal weight distribution throughout the entire duration of your kitchen tasks. If you feel your hips try to drift to one side, instantly drop your weight back into the center lines. The variables. Practice this conscious parallel stance every single time you are at the kitchen sink for the next 14 days, until it becomes a permanent neurological anchor. The clinical data from Gary's case study proves an unyielding biological truth. Your walking balance and your lifespan longevity are not destroyed by massive sudden accidents. They are slowly, silently eroded by the microscopic, repetitive mechanical mistakes you make inside your own home every single day. Every evening you stand at your dishwasher and allow your pelvis to warp sideways, you are actively drafting the blueprint for your own physical decline. You are telling your brain to switch off the very stabilizer muscles required to keep you upright when walking down a flight of stairs or crossing a busy street. Therefore, you must treat this parallel kitchen stance and counter-lateral hip reset not as an optional fitness routine, but as a critical, life-preserving medical prescription. Just as you would never allow yourself to skip your vital cardiovascular medications, you must never allow your skeleton to sink into a collapsed posture while performing your daily life activities. This tiny investment of structural awareness in your kitchen is your ultimate shield against severe hip replacements, spinal joint decay, and the terrifying onset of a shuffling, dependent stride. Take complete control of your alignment starting tonight. Your body possesses an absolutely magnificent lifelong capacity for structural regeneration. Your muscles, your motor nerves, and your connective tissues are fully hardwired to remodel, strengthen, and correct their tracking according to the exact challenges you place upon them, whether you are 70, 80, or 90 years old. Aging does not mean you are condemned to walk with a limping, hesitant stride. You hold the precise clinical tools right now to level your pelvis and master your movement. Stop letting simple daily habits shrink the boundaries of your physical freedom. Do not step back from the world. Wake up the sleeping stabilizers inside your hips, balance your structural architecture, level your walking base, and step forward into your future with a tall posture, fluid weightless strides, absolute confidence, and complete, total sovereignty over your movement and your lifespan freedom. If this investigative biomechanical masterclass shed light on your health journey today, please support our mission by hitting that like button. Share this video immediately with your spouse, your friends, your neighbors, or anyone over 70 who deserves to stand tall, safe, and entirely independent for all the golden years to come. Thank you for investing your valuable time with me today. I am Dr. Arthur. Balance your foundation, move with absolute power, and I will see you in our next clinical health blueprint video.